Well, I need to talk about trans fatty acids. We've talked about this forever. It's one of the bad things we have to get rid of, the margarines, the fried foods. And big headlines today, in the USA Today, it's like about a third of a page. It's a big story, but it was like, I don't know, on page 3 or something like that of the front section. Here comes the headlines. FDA aims to banish trans fatty acids from food supply. Some companies may find the plan difficult to swallow. Okay, the Food and Drug Administration plans to take artificial trans fats entirely out of the food supply, is forcing the food industry, to scramble to reformulate the remaining products. Let's see here. It says that the Grocery Manufacturers of America said that since 2005, food manufacturers have already lowered trans fats in products by more than 73%. Today, the FDA says 12% of all packaged foods contain a partially hydrogenated oil, the formal name for trans fats. Numerous studies have shown that consumption of trans fats can have, quote, lots, that sounds scientific, lots of adverse health effects, including raising bad cholesterol and lowering good cholesterol. A professor of nutrition from Penn State University. There's really no safe level of consumption of trans fats, the FDA said. Centers for Disease Control and Prevention estimates that 5,000 America a year die of heart disease because of trans fats is in the food supply. Another 15,000 will get heart disease, said the CDC director. Now, doctors, according to the CDC, kill, injure, and infect 15 million Americans each year in their workplace. So trans fats at 5,000, and that's sort of doctors kill each year, this is a yearly figure, kill, injure, and infect 15 million of their patients or customers in their workplace, hospitals and clinics. That's yearly. Now, how many people would fly commercial airlines if they knew that they killed, injured, and infected 15 million passengers? Nobody'd fly, okay? But I do, and you've heard me say this for 25 years, get rid of the bad stuff out of your diet. No fried foods, no processed meats with nitrates and nitrites, no oils, no margarines, mayonnaise, salad dressings. And the ones that they point to that have still lots of trans fatty acids are coffee creamers. The coffee creamers, canned frostings, butter-based frostings melt and turn into puddles of goo. Trans fats stay solid. Okay, stick and tub margarine, turning vegetable oil into a spreadable solid requires a chemical change. Baked goods, solid fats such as butter, lard, or shortening make cakes and cookies tender and to allow them to brown. Creating a solid fat from vegetable oils without trans fat is possible, but more expensive. Microwave popcorn is one of the worst. Trans fats can be formulated to melt at the exactly the temperatures when the kernels pop. Candies, many chewable candies, chewy candies require fat to keep them moist and to protect the sugar in them from crystallizing. And those are the places you're going to find trans fats. You also find them in French fries. You'll find them in things like bagels and stuff like that. They're kind of all over the place. You really need to read labels very carefully. I urge you to get a hold of that book, Dead Doctors Don't Lie. Look at this whole story of bad stuff, trans fatty acids that's in our diets. Get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with 900 different diseases using vitamins, minerals, and trace minerals, and rare earths, amino acids, fatty acids, herbs, aromatherapy oils. That's, again, the book, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. And then the book, Immortality, comes at it from a different direction. It shows what the long-lived people eat. And the long-lived people, the top 20 long-lived cultures on Earth that have 40 times 100-year-olds we do. They have 100-year-old per 250 of the population. We have 100-year-old per 10,000. They live on eggs, butter, cream, and lard. They don't use margarines. They don't use trans fatty acids, and they have 40 times 100-year-olds we do. Well, that's why I've been screaming about trans fats forever. If you ever listen to me in a lecture, you listen to me on this show when I'm talking to people about changing their diets, their lifestyle, you have to get rid of the trans fats out of your life. No fried foods, no processed meats, no nitrates, no nitrites, no oils, no margarines, mayonnaise, salad dressing, cooking oils. If you're eating canned fish, it's fine, but canned fish have to be packed in water, mustard, tomato sauce, not oils. And I'm going to get a hold of that CD, also called Serial Killers. It goes into, and gluten goes along a lot with trans fats because they use trans fats to deal with gluten-type foods. And we're talking about pastas. They're used in pasta crust. They're used in spaghettis and noodles. They're used in all kinds of like soups to kind of give it the little bit of fat floating in there. But they don't want to use buttercream and lard because it increases the amount of saturated fat in the diet, which is not bad. Saturated fat is actually good. Again, America has bet on the wrong horse by worrying about good cholesterol, bad cholesterol. It's very clear. It doesn't matter if your total cholesterol could be HDL. Your total cholesterol could be HDL, high-density lipoprotein, the good cholesterol. It's not going to affect your risk of heart disease because it has nothing to do with heart disease. It's all fried foods, trans fatty acids, heterocyclic amines, oils, and also gluten. Got to get rid of this stuff out of your diet. You'll have 25 years to your life. Don't forget the 90 essential nutrients. Add another 25 years to your life. Well, stick with us. We're going to be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
I've got a Fox News story here today about ADHD. We've talked in the past about how there seem to be more and more people taking drugs for ADHD, and they said wider HDA definition risks unnecessary medication, says experts. They say a wider definition of attention deficit hyperactivity disorder is causing an inappropriate diagnosis and unnecessary harmful medication treatment costing up to $500 million in the United States alone. They go on to say less restrictive diagnostic criteria have contributed to a steep rise in diagnosis for the behavioral and brain condition, particularly among children. They say the broader definition also devalues the diagnosis in those with serious problems. That's according to the lead researcher here, Ray Thomas, from Australia's Bond University. This was all published in the British Medical Journal. They say ADHD is excessively restless, impulsive, and easily distracted patients, especially among children, a condition that could have them having trouble in school. And this was the one I found kind of interesting. They say there is no cure, but symptoms can be kept in check by a combination of behavioral therapy and medications such as Ritalin or a newer drug called Vyvanse. And they go on to say that experts not involved in the analysis said its conclusions were interesting, but should be viewed with caution. That comes from Barbara Sahakian, a professor of clinical neuropsychology at the University of Cambridge. She says, I suspect that the reason for increased prescriptions for Ritalin and similar medications for ADHD has to do with better detection of the condition in children and the recognition that 50% or more of children with ADHD still have it as adults. And they go on to say the criteria for diagnosis to be diagnosed with ADHD is actually set out by the International Classification of Diseases, or the ICD, or the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, or the DSM. They say in Australia, the data showed a 73% increase for ADHD medication between 2000 and 2011, and they found while prescriptions in Britain increased twofold for children and adolescents, it increased fourfold in adults between 03 and 08, and what they're prescribing are these drugs called methylphenidates or amphetamines, two types of drugs used. They have increased steadily in the United States between 96 and 08, and with the greatest increase in adolescents between the age of 13 and 18. Wow.
Yeah, and of course, in 1980, there was like 1 out of 150,000 kids with ADD, ADHD, and autism. Then in the year 2000, 20 years later, it was 1 out of 150. And then 2010 is like 1 out of 115. Okay, and they're saying by 2050 it's going to be 1 out of 5. Now, 95% of all autism, ADD, and ADHD occur here in the United States. In third world countries, they don't have it because they're still feeding their kids their traditional cultural diets. How close to the traditional cultural diets of all the various sort of immigrant groups that came to America are Fruity Pebbles and apple juice? What about instant oatmeal and Sunny Delight? What about things like gummy bears and Welch's grape juice? None of these things even come close to cultural diets, and they're just nothing but sugar and carbohydrates. In April of 2012, April 16th to be exact, in Food Chemistry, a very well-respected journal that looks at the nutritional value of food, they looked at the top 8 commercial baby foods here in America, Enfamil, Similac, Gerber's, and many others, 5 others, and they say they contain less than 20% of the recommended levels of minerals and vitamins, less than 20%. Now, dog food has 100%. Laboratory rat food has 100%. Chicken food has 100%. Dairy cattle have 100%. Our babies have less than 20%. Somebody needs to go to jail here because these kids have malnutrition. We got to give them supplement the 90 essential nutrients, and it'll straighten out the problem. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Michigan. And Emma, you're on with Dr. Wallach.
Hello, Emma, you're on the air.
Hi, Dr. Wallach. I called back in May about my parathyroid, hyperparathyroid condition, and I've been taking the supplements ever since. And I want to tell you, these are the things that have improved. I don't have the anxiety attacks anymore. I had pain in my shoulder, and the pain has stopped. I had ringing in the ear, and it's quieter. And I have varicose veins, and they're clearing up. And that brings me to what I called for too, was the water. I feel like I have water running down the side of my thigh, my right thigh. And I have the beginnings of cataracts. So.
Okay, well, good. You're showing lots of progress. That's a good thing.
Yeah.
Okay, well, let's look at the cataracts, and let's look at this tingly feeling like there's something running down is it the outside or inside of your thigh?
It feels like it's running down the outside, but it's inside.
Okay. All right. Now, are you leaking urine, or this is just a feeling?
It's just a feeling.
Okay. Now, whenever you have these sort of tingly things, you're feeling movement. A lot of people call them creepy crawlies. They think they've got parasites and all this kind of stuff. And basically, this is a back problem, degenerative disc disease. How much glucogel are you taking every day, Emma?
15.
15 a day? Good. Okay. Are you on a complete gluten-free diet?
Yes.
Okay, good. And have you had this before, or is this something new?
It's something new. It started about 3 weeks ago, but I have to tell you that it's subsided some in the last couple of days.
Okay, good. Yeah, you may have, I don't know, 3 weeks ago, did you unload a truck or work in the garden or clean out the attic?
Oh, I have been doing a lot of work.
Okay, you've been doing some physical work. Okay. So, yeah, basically that's a back problem, and the fact that it's kind of getting better now. Next time you're going to do some physical work, take 20 glucogel a day during that period, and then for 5 days afterwards, and then cut back down to the 15, okay? Now, what do you weigh?
150.
150. Okay. Hang on. Get your pen and paper. When we come back, I'll tell you what to do for the cataracts. Okay, Doug, let's go right back to Michigan and Emma. Okay, cataracts, I would just add to your program, if you're not already doing it, 3 of our Ultimate Selenium twice a day, 3 at breakfast, 3 at dinner. That's 2 bottles a month. And take extra care, again, staying away from gluten, staying away from, and this includes the dog and the cat and anybody else in the house, because of cross-contamination on food preparation services, the couch, the bed, the rugs, the laundry, washer and dryer. It's got to be drop-dead gluten-free. Don't forget, 3 selenium twice a day. That's 2 bottles a month. Okay, Doug, let's go to callers.
Let's head to the UK. And Laura, you're on with Dr. Wallach.
Hello, Laura, you're on the air.
Hi, Dr. Wallach. I'm
Hi.
calling about an issue my husband has. His doctor thinks that there might be a trapped nerve in his upper back. Initially manifested as tennis elbow, but now his whole arm feels like it has pins and needles. There's shooting pain from his shoulder to his fingers. His fingers go numb, and it gets worse at night when he's lying down, and he can't sleep due to the pain. And I have him taking the BTT, vitamin D, vitamin C, niacinamide, niacin, and the fish oil. And his doctor has him on 800 milligrams of ibuprofen. He's tried acupuncture, and nothing has helped.
Okay. Okay, it's very useful. If he's on ibuprofen, that's not solving the problem. Okay,
Yeah,
that's a good thing to tell me.
so.
Very good. Okay.
And he also has high blood pressure and high cholesterol.
Okay. What's high cholesterol?
It's over 240.
Okay, 220, 270 is normal. Do not let your husband do not let him take any statin drugs to lower cholesterol, okay? If you've been prescribed them, don't fulfill the prescription. Okay, now, when it comes to this sort of thing, and it gets worse when you lay down, it's always a back and neck problem, okay? Especially when he has tingling in the fingers, it's going to be a neck and a upper back problem. Shar?
Mm-hmm. Yes?
What'd you do for peripheral neuropathies? It's kind of like sciatica, the hands, and it could be one arm, could be both arms. And doctors have checked him out, can't find anything out. What would you do for peripheral neuropathies stemming from his neck and his... Yeah, okay. Well, how many glucogel?
If he's a big guy, he probably should have 15 a day, 5 with each meal.
Okay. And so I'd have him take, as you point out, 2 of the Healthy Bone and Joint Packs, 1 full dose of the OsteoX Plus breakfast dinner. That's 1 ounce of breakfast dinner. I'd give him 15 glucogel a day, like Shar said. There'd be 5 at breakfast, 5 at lunch, 5 at dinner. 2 scoops of the Beyond Tangerine NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and all that will be accomplished by 2 healthy bone and joint packs. And then there's the CM cream that comes along with it, and he can apply that CM cream to his neck, right down the middle of the back of his neck, and the upper back, the first third of his back, upper back, kind of like between his shoulder blades up to his neck. And it might take 10 to 15 minutes to get significant benefit in the arms by putting this on the neck. If you put it on the arms, you're not going to get any effect because it's all going up and down his neck and upper back. And we know that because when he lays down, it kicks in. That's very typical of back, neck problems. Okay, thank you, Shar. Good job. Okay, we'll be back with more Truth, Justice, and the Youngevity Way after these messages. Okay, Doug, let's go to callers.
Let's head to Tupelo, Mississippi. And Veronica, you're on with Dr. Wallach.
Hello, Veronica. You're on the air.
Hi, Dr. Wallach. My 18-year-old cat 12 days ago had a stroke-like episode. I'm not sure if it was a stroke, and the vet's not sure either. But she's still unable to stand. I'm having to syringe feed her and give her sub-Q fluid. And the right side of her face is not working. It's like, frozen.
Like Bell's palsy kind of stuff.
Yeah, well, she had her yearly checkup a couple of months ago, and she was in early kidney failure.
Mm-hmm.
And then about a month after that, she had a third eyelid come up, and I took her back, and they said it was probably Horner syndrome. And then, just less than 2 weeks ago.
What does the cat weigh, you think?
She's about 6.5 pounds. Her normal weight was 11, but she started losing weight about a year ago.
Okay. Yeah, there could be something more sinister. I mean, did the doctor take any x-rays or ultrasounds of her head?
No, we didn't do any of that. We just put her on fluids. We gave her a Valium to calm her down because she was just, her head's kind of tilting to one side, and it could be, she said, vestibular or something.
Mm-hmm. Okay, well...
She thinks it may be like an inner ear or middle ear causing that one.
If you can't walk, I think it's probably worse than that. I mean, cats get MS, they get stroke, they get all kinds of stuff.
Right.
And so, Shar, what would you do for you deal with small animals quite a bit. You have a little puppy dog that weighs less than that.
Yep.
And so, what supplement program would you give Veronica's cat?
Arthrodex, first, Arthrodex.
Yeah, I'd give it a half a scoop, which is a little heavy because it's 1 scoop per 25 pounds of body weight. But I'd go ahead and kind of overdose the cat a little bit. I'd give it a half a scoop a day of the Arthrodex. And what else would you give the cat?
Selenium.
Okay, good. And I'd go ahead and give the cat a half of a selenium capsule, dump it out, open up, dump it out in the plate. Take a butter knife, make 2 equal piles, and then take one of those half capsule piles and put in whatever fluid you're giving the cat. And I would also give it Smart FX, just in case there's something going on in the brain. I'd give it 1 Smart FX capsule, puncture the capsule, and put it in the fluid you're squirting down the cat's throat with a syringe. And be sure that you get some kind of fluids from the vet, saline or something like that, and some clean syringes, and do whatever is dose appropriate to give fluid twice a day to that cat under the skin with a syringe, and keep it well hydrated. Otherwise, dehydration, especially with a history of sort of early kidney stuff, you might get some problems. Or give us a call. Let us know how the little cat's doing. Okay, Doug, let's go to callers.
Let's head to Mississippi and Mac. You're on with Dr. Wallach.
Hey,
okay, I'm sorry, was that Mac?
Yes, sir. M-A-C-K.
Okay, how can we help you?
My girlfriend has a 90-pound American Bulldog, 4 years old, and about 3 months ago she had a bad rash, and the veterinarian gave her steroids a couple of times for that, injections. But she still has these bumps under her skin that are itchy, and some of them are protruding through the skin. They're little pink bumps sticking out through the skin, and they look kind of like teeth. Also,
I get
muzzle.
it. Question. Did you change the food a week or so before?
Yeah, that was the initial breakout. The food was changed.
Mm-hmm.
We went back to her original food.
Okay. How long ago did you go back to the original food?
About 2 months ago.
Yeah, okay. And has it begun to get better or staying the same or getting worse?
Well, the rash has gone away completely, but she still has these itchy bumps under her skin.
Okay, what do you think happened there, Shar?
She might have celiac.
Yep, might have had a gluten exposure. Yep, and then dogs get it. And these itchy little bumps is called keratosis. It's a vitamin A deficiency that goes along with a gluten intolerance. And a lot of these new dog foods, they put a lot of whole grains in there because it's anthropomorphic. People want to do the right thing for their dogs, and everybody knows that whole grain's good for you because everybody says whole grain's good for you, so why not for your dog? That's not true. Dogs have big, long canine teeth, which means they're built to shred and eat meat and so forth and not eat whole grain bread, although they can survive on it for a week or two if necessary. But you did the right thing to change the food back. But I would get some, go to the local pharmacy or health food store and get a bottle of some of these vitamin A capsules that have 10,000 units per capsule or the size of a pea. Plop a couple of those down into the dog, give them the Arthrodex. I'd give them 4 scoops a day. It's 1 scoop for 25 pounds of body weight. Give that dog 4 scoops of the Arthrodex every day in his food. Stay with the original food. And the fact that the bumps have all gone away, but you still have these little pink spots, I think with the vitamin A, that will go away pretty quickly. Okay? Just keep them on the Arthrodex and keep them on the early dog food. Okay, Doug, let's go to callers.
Let's head to Illinois. And Tiffany, you're on with Dr. Wallach.
Hello, Tiffany, you're on the air.
Hi, Dr. Wallach. This is Tiffany. I'm calling about my mom.
Okay.
She was on psychiatric pills for about 12 months now, and they did her damage. She lost appetite, she's lost weight, and we ended up in hospice. And she's laying around now, but she's been doing better.
Is she at home or is she at hospice?
She's at home. We're at home.
Okay.
And we were fine. This happened in a 6-month time. She was on these pills, and I was told not to do it, but I didn't understand it. And it ravished her down to where she's home now. She's a very active grandmother. She does Pilates, exercise. She's very active, church, shopping, the whole bit.
And so what's her main symptoms now?
Her main symptoms, she doesn't eat. She's lost weight. And I was told I should have did transmitters, the neurotransmitters test, where you would look to see if the transmitters were low. And this is all after the fact because it could have been a possibility that all her transmitters were low because at one time she was hallucinating and having agitation and et cetera.
Sure.
So this is why.
Okay, what does your mom weigh?
Pardon me?
What does she weigh?
Well, now she's 150. But we were in the hospital 3-4 times in 2 months. And they took her off of all psychotic pills, all of them, except one, which is Stelacin. They did not agree with them. So I wanted to know, should I get her neurotransmitters done, do the test? And I know it's a urine test, but it's been difficult because she's bedridden.
Here's what I would do. Here's what I would do. Well, first of all, Shar,
yes.
what would you give Tiffany's mom just to increase her neurotransmitters?
Vitamin, Smart FX for one.
Oh, perfect. Smart FX, exactly. And at 150 pounds, I would go with three times a day, 3 at breakfast, 3 at lunch, 3 at dinner. I'd kind of hit her hard with it. They're small little capsules, soft gel capsules the size of a pea. Little kids eat them up. And if she can't swallow them, she won't swallow them. You just go ahead and puncture them, squirt the contents, 3 times a day into a big heaping tablespoonful of applesauce and give it to her. And make sure she's getting the 90 essential nutrients. Healthy Start Pack, I'd give her the 2.0. and then call us every 2 weeks. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and 90 for Life Crusade. And Doug, let's go to callers.
Let's head to California. And Joan, you're on with Dr. Wallach.
Oh, Joan, you're on the air.
Hi, Dr. Wallach. I've been doing Youngevity for about a month or so now, and I'm going to be traveling some, and I was wondering how to do, would it be possible to put, instead of doing the liquids, to have it, put it into a capsule? Because that'd be easier when traveling.
Sure.
Can I take the powders and put them into a capsule and just take that?
Yeah, well, you can do that if you wish, or you can get. We have actually we actually have the Healthy Start Pack to go, which is little envelopes with they're all in capsule and tablet form. 30 envelopes, and that's it's called the Healthy Start Pack to go.
Mm-hmm.
Okay. Also, you can get the Healthy Start Pack 2.0, which has the powdered 2.0 Beyond Tangerine, the powdered Osteo FX. It's all kind of based for vegetarians. All the shellfish have been taken out of it. And let's see here, the EFA, obviously the EFA pluses, those are soft gel capsules, so they're light and easy to take. You can put it. You can either take the jar of them or take a couple of Ziploc bags with a handful or a tablespoon of those things in there. So yeah, you can get it down to just the soft gel capsules for the EFAs, pluses, and everything else can be powder or capsules.
And I could take the powder from the 2.0 and put it in capsules to make it.
Well, you can do it yourself if you want, sure.
Mm-hmm. But the to-go puts it in capsules already, you said.
That's right. There's one envelope per 100 pounds of body weight per day. So if you weigh 200 pounds, it'd be one.
I weigh about 100, so that's
okay.
good.
If you weigh 100, one of those little envelopes will do you. There's 30 of those envelopes in a box.
Okay. Great.
Okay?
Thank you very much.
You're very welcome. Okay, let's see here. Our time. Let's see if we can squish in one more.
All right, let's head to Florida. And Brian, you're on with Dr. Wallach.
Well, Brian, you're on the air.
Hi, Dr. Wallach. I'm calling in regards to my father. He's about 300 to 400 pounds right now. He's had diabetes pretty much his whole life.
Wait a minute, 300, whoa. 340 pounds?
300 to 400 pounds.
Oh, that's a big range, okay.
And he's had some neuropathy, some on his whole life, foot infections. He's on statin drugs. And I'm just trying to figure out, where to start with him. The best step for him.
Okay, Shar, you want to take this one?
Oh, boy. Well, if he weighs 400 pounds, he needs 4 Healthy Start Packs, but he also needs, for neuropathy, he's going to have to take the glucogel, too. And does he have...
He said he has diabetes.
Oh, he needs the sweetie, so you might want to take the Healthy Sugar Pack.
Yeah, that's what I do. Is I'd have him take a minimum of 3. If he weighs like 320, 340, I'd give him 3 of the Healthy Blood Sugar Packs a month. So that'll be 1 ounce of the Osteo FX Plus at breakfast, lunch, and dinner. It would be... let's see if that's 3. It'd be 1 ounce at breakfast, lunch. 1 ounce of breakfast, lunch, and dinner. The Osteo X Plus, 2 scoops of the Beyond Tangerine NutriCrystals at breakfast, lunch, and dinner. 3 of the EFA Pluses at breakfast, lunch, and dinner, and then 3 of the Sweeties at breakfast, lunch, and dinner. He's obligated to take his fasting blood sugar in the morning before he medicates himself. And for weight loss, what would you give him, Shar?
ASAP, as slim as possible.
Okay, as slim as possible, as soon as possible. Exactly. And how would you have him dose himself?
Oh, boy. He could take it probably 3 times a day until he gets his
30
weight
minutes before each meal. Yep. So that'd be, and he could do, like you say, get him 2 bottles a month, and I'd have him take 1 dropper full under his tongue, not 1 drop, but 1 dropper full under his tongue 30 minutes before each meal, and then again 1 dropper full under his tongue 15 minutes before each meal. It'll require 2 bottles a month to do that. He's going to lose weight, which is going to help him with his diabetes. He's going to have all the nutrients necessary, because type 2 diabetes is, in fact, a nutritional deficiency of minerals. It's not a genetic disease. So all this is workable very quickly. Get him on this here, if you would, please, and then get back to us as quickly as possible every 2 weeks. I want to know his weight, his blood pressure, and his blood sugar. Thank you, Shar. Super job. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.